My name is Collen Masimirembwa. I'm the President and Chief Scientific Officer of the African Institute of Biomedical Science and Technology in Zimbabwe. I'm a Professor of Biochemical Pharmacology, and I'm here at STIAS as a Fellow. And I'll be working on two aspects of the work I'm involved in. One is on the scope of counterfeit drugs and substandard medicines, where we are putting together a book with fellows in Sweden and also here in South Africa, and where we are trying to evaluate the extent of this problem. The second project I'm working on is on genomic medicine, where we are looking at the genetic variation of African people and its implications for health. So the work we are doing with respect to counterfeit medicines and substandard medicines is a project which is being led by Susanne Lundin from Sweden, Lund University. And what we are looking at is the challenge of the African market and indeed the world at large having access to medicines which are not approved, and that this could have health implications where the medicines might not be working as expected, so people's conditions do not resolve, or indeed they might be containing other poisonous components, in which situation they can end up with a medical condition needing extra attention. So also the advent of sale of medicines online has created a huge opportunity for those people involved in counterfeit medicines, because people simply go onto the internet and there they are enticed by wonderful solutions for their conditions and they do these purchases. So we are really looking at different players in the legal field, in the logistics in terms of drug shortages being precipitating the problem that if somebody doesn't get their medicines in time, they might look for alternative sources and they fall prey to some of these people trading these bad medicines. So we're really looking across all these areas in terms of the local regulatory authorities. What are they doing to combat this problem? And also the countries from which these products are coming, are there any actions that are being taken to regulate? So there are all these legal matters to also look at. So we hope that by the time we have a stakeholders meeting and put this book together, we will make a contribution important to society with respect to counterfeit drugs and substandard medicines. So the area of genomic medicine is a continuation of the work we've been doing over the past 20 years, where we started to notice that some medicines will work differently between individuals. And later on we understood that it is because of inter-individual variation in the genes that regulate how those drugs work. One with respect to how the body handles the medicine, which we normally call pharmacokinetics, and with respect to what the drug does to the body, which we normally call pharmacodynamics. Then when we started to look at African populations versus European populations, we started to see yet another level of difference at population level. That some drugs were working differently in Europeans compared to African populations. And this had big implications, which made us make this a key research topic, because most drugs we are using in Africa were developed and optimized for effectiveness and safety in the European populations. And then they were distributed worldwide, including to Africa, in populations where they are now seen to work differently. And our work has been trying to understand the mechanism of that difference. And to that effect, we have been sequencing the genomes of African people to try to find the rationale or the reason for these differences. And indeed, we have found a number of differences which have helped us to understand why, for example, a drug like efavirenz, which is used for the treatment of HIV, causes more side effects amongst people of African ancestry compared to people of European ancestry. And that knowledge has helped us now to recommend a change in the amount of drug given to the patients. from the then standard of 600 to the now recommended WHO value of 400 milligrams a day. And associated with that, we have developed a genetic test that can identify those 30 or 40% patients at risk of these adverse drug reactions.